Let's try to solve this problem. So this question is about if a patient has a low sugar level and is unconscious, so what you gonna do next? Okay, let's read the question and let's solve the answer, and we will eliminate one at a time, right? So let's do it. So an unconscious diabetic patient is receiving continuous tube feeding at 45 cc an hour and blood sugar check every 6 hours, right? At 6 o'clock, the patient blood sugar is 65 mg per dl, right? The nurse observed that the patient is diaphoretic, tachycardic, and has cold, clammy skin. The nurse action is appropriate if she. So if patient blood sugar is 65, mostly the normal numbers are in between, like it's supposed to be more than 70, right? If it's less than 70, then usually you give orange juice or some kind of juice, right? Right. So right now, but the question is saying the patient is unconscious, right? So what the nurse gonna do? So let's eliminate one at a time. Option A, administer 4 oz of orange juice orally. You cannot give orally because the patient is unconscious. How patient gonna swallow the juice? If patient is alert, conscious, then you can give orange juice, right? But at this time, patient is unconscious, so you have to read carefully. So eliminate option A, right? Let's go B. Mix 4 oz of orange juice on her feeding bag. So you can also eliminate option B because it is not appropriate to administer orange juice through the feeding tube. You cannot mix any juice in the formula. So you can also eliminate number B. Let's see number C. Give 25 ml of dextrose 50% IV. We will keep this meanwhile. And let's go to number D. Administer regular insulin per sliding scale. So if the patient sugar is already 65, if you give insulin, it's gonna worse the condition. It's gonna drop more, right? It's gonna drop more. So option C says give 25 ml of dextrose. So dextrose means sugar water. It has 25 gram added, right? It has 25 gram sugar added in the dextrose water. So this is the best option to give, and this is also used for emergency situation. So you're gonna give via IV. So your correct answer is, so during your exam, whenever you see this option, if patient is unconscious, then you should give immediately 25 ml to 50 ml of dextrose 50% IV. So that's how we're gonna solve this problem. Eliminate and find a right answer. So your answer C is the correct answer.